Let's get more now on what Mayor de Blasio had to say late this afternoon in a press conference. CBS 2's Lisa Rosner is live in Manhattan on the West Side. Lisa.
Well, Dana, one of the headlines coming out of this press conference is that the NYPD will begin fining those who do not practice social distancing, anywhere between $250 and $500. And right behind me, Pier 90, this is where USNS Comfort is scheduled to dock around 11 a.m. tomorrow. As you mentioned, a field hospital is being built in Central Park, and all of this is being done as area hospitals struggle to treat the growing number of cases. A 68-bed emergency field hospital is being built near 5th Avenue and 99th Street in Central Park by Samaritan's Purse, a Christian organization based in North Carolina that also helped in Italy.
Going up now in the East Meadow, should be operational by Tuesday.
Thousands of masks and gowns donated to city hospitals by the Chinese-American Independent Practice Association this weekend. But still, Mayor de Blasio told CNN Sunday there's only enough supplies to last a week. That's until next Sunday. And hospitals need hundreds of ventilators.
I've made a direct request to the president and to the military to find us immediately more military medical personnel and get them here by next Sunday, but also to start figuring out how to get civilian medical personnel from around the country here.
New York Governor Andrew Cuomo says the Javits Center Field Hospital will be ready this week, but will only be utilized when it's needed, likely at the apex, which is approaching at a slower rate than before.
Now it's doubling every 6 days. So you have almost a dichotomy. The doubling rate is slowing, and that is good news. But the number of cases are still going up.
Meantime, New York paused the closing of non-essential business, and the ban of gatherings is extended until at least April 15th, which means no churches open for Easter, and families who do not live together should not be gathering for Passover Seders.
It's hard. But on the flip side, I say, look at what happened in New Rochelle. Those gatherings that brought people together were religious gatherings and brought hundreds of people together, which was beautiful, but it made many, many people ill. And density is the enemy here for this particular time. By the way, the patient zero, what we call patient zero in Westchester, New Rochelle, who was very sick for a very long time, he has actually gone home. Am I correct in that?
Just went out of the hospital.
He's out of the hospital.
In New Jersey, the number of cases is almost 10 times more than a week ago, standing at around 11,000. The governor says they've received more protective gear for healthcare workers, but he's asking the White House to help get more ventilators. All residents are being asked to stay home, except for essential travel.
We are de facto staying at home as a state. There are 9 million of us. You're absolutely right. The numbers have gone up dramatically, but we expected this, and we told our folks it would happen. Part of it's due to community spread, but a big part of it is we have opened up testing aggressively.
On CNN, Mayor de Blasio was asked if he's to blame for the virus rapidly spreading by telling New Yorkers to go about their lives, even 2 weeks ago on March 13th.
We all were working, everybody was working with the information we had and trying, of course, to avoid panic. And at that point, for all of us, trying to keep not only protect lives, but keep the economy and the livelihoods together.
De Blasio added that he has been warning that there just were not enough tests, and had there been more access to testing, we would have been in a different reality. Governor Cuomo was also asked if he felt he was too late to respond. He said New York was one of the first states in the country to act. We are live on the West Side. Lisa Rosner, CBS 2 News.